Hi, it's Michelle with the Medicine Couch, and it is PA week as I'm recording this video. And I want to start off by wishing a happy PA week to all my colleagues and friends who are PAs and say thank you for all that you do. But I have to say, right now I'm not feeling very celebrated as a PA. I'm feeling attacked and I'm frustrated, and quite frankly, I'm just pissed off. There's this campaign against our professions that's spreading lies, and it's just kind of a smear campaign. So I want to address it and talk about it a little bit. For those who may not know what the AMA Scope Creep campaign is, let me read directly from their website. They say, patients deserve care led by physicians, the most highly educated, trained, and skilled healthcare professionals. The AMA vigorously defends the practice of medicine against scope of practice expansion that threaten patient safety. Now, on the surface, that statement sounds reasonable. It sounds like it's something that should happen. There should be discussions about what is safe and not safe in medicine. And as physicians have traditionally and still are the head of the clinical teams, they are the right ones to ask the question. So I'm not upset that they're asking this question or they're looking into it. I think that, like I said, that's what should be done. And I'm all for healthy debate, and I'm all for looking at the pros and cons of each side and really figuring out what is best and what is the way to move forward. But my problem is that I don't feel like this AMA scope creep campaign does that. There's certainly no healthy debate. And I feel like they're just using tactics like lying and bullying and relying on very flimsy data to do all this. I want to show you what I'm talking about. I'm going to give you concrete examples and talk about why what they're saying is so inflammatory and in most cases just flat out wrong. And also how it just completely ignores the current landscape of medicine and how PAs are actually practicing. Now, I want to take this moment to say that the rest of this talk is going to be pretty much just about PAs and the PA profession. The Scope Creep campaign is actually against several different professions, including PAs, NPs, optometrists, pharmacists, chiropractors, and others. But I can't speak to all of those. I really just want to focus from a PA perspective. I also want to acknowledge that I know that the AMA does not speak for and represent probably the majority of physicians in this country. In fact, their membership is less than 20% of all physicians. Another thing I want to say is that this video is not to debate whether PAs or NPs or anybody else should have independence or OTP, which is optimal team practice, which is what the PA legislation is looking for. I'm not debating the merits. It's just strictly talking about the scope creep campaign itself. So first of all, the heart of what they're saying is that we are looking for scope expansion. I want to read to you what the PA scope of practice is according to the Texas Medical Board, which is where I live. So this is what they are saying is the scope of PA practice currently. The physician assistant shall provide, within the education, training, and experience of the physician assistant, medical services that are delegated by the supervising physician. Duties may include, but are not limited to, obtaining patient histories and performing physical exams, ordering and performing diagnostic and therapeutic procedures, formulating working diagnoses, coming up with treatment plans and implementing them, monitoring the effectiveness of those treatment plans, assisting in surgery, offering counseling and education to patients, requesting, receiving, and signing for pharmaceutical samples, prescribing or ordering a drug or device, and finally making appropriate referrals. So these are things that PAs are already doing, that I have done my whole career, that every PA I worked with does the same thing. So the OTP bills, optimal team practice, that PA organizations are trying to pass through in different states are not asking for us to do anything more than what is already spelled out in this scope of practice, anything more than we are already doing every day, day in and day out, all across the country. We're not asking to do solo surgeries or anything like that. We're not going to magically just start doing all kinds of crazy things. We're going to remain within our scope, which is well defined, it says, by our training, our education, and our experience. So I don't know how what we're asking for is actually going to expand our scope of practice, which is the whole premise of what their campaign is based on. Now, I don't know what the other professions are looking for. I may know a little bit. Like when it comes to surgery, I think optometrists are looking to do some eye surgeries or something. But I'm talking about PAs. We're not looking and asking to do anything that we're not already currently doing. So that's important to remember in this. Oh, actually, I'm lying. The change in the laws that would dissolve having a supervising physician would result in me being able to do some things I can't do now. And you want to know what those things are? They would be, terrible things like volunteering at free clinics or volunteering to work the medical tent at a fun run or at children's summer camp or even participating in disaster relief. Right now, I know there's PAs looking to help in Western North Carolina, and they have to find a supervising physician who will sign off on them that they will take responsibility for whatever the PA is going to go do, even though the MD will not be there, not know what they're doing or anything. They just have to sign off on some paper saying that they're going to supervise them. Other than that, the only other difference is that sentence where it says that the medical services are being delegated to the PA from the supervising physician. So again, for those who may not know, that probably sounds like a great thing. It probably sounds like physicians are sitting down with PAs when they get hired and start working, and they go through and determine what the PA has been trained on, what the PA feels comfortable doing, and how much experience they have doing it. But no, that's not how it works, especially if we're talking about hospitals or larger organizations. In my experience, I've just been given a bunch of paperwork, and in that paperwork, there's the credentialing sheets that have you go through and you self-identify like what you've been trained in. You write kind of what experience you have with different procedures, and you mark what you want to be credentialed for. In other words, what you feel comfortable doing. I don't know if a physician ever looks at those, but even if they do, they've never met me or talked to me about my skills. So I guess they just sign off on it if they have to even sign off. So there's really not a lot of oversight there. Most of the oversight comes from the clinics and hospitals' policies and procedures themselves that we have to follow. So let's talk about the point where it says that we're trying to do these things without having proper training. And here I want to go to the interview with Dr. Callis, who's president of the Texas Medical Board. And I want you to hear in his own words in this AMA interview. So he says, the threat of scope creep has never been higher in the state of Texas. We have everyone from every angle trying to be doctors without really having a license, like APRNs, PAs, chiropractors, optometrists, dentists, and even unlicensed people. These groups want to do everything from open med spas to start IV clinics to perform surgery. They don't even have any training, much less experience and the oversight to do these kinds of procedures. So let's unpack that. Let's look at specific sentences. First of all, the trying to be doctors without having a license, like APRNs and PAs. Well, no, Dr. Callis, I'm not trying to be a physician. I don't pretend to be a physician. I don't represent myself as a physician. I respect the training that physicians have, but I also understand the training that we have. I'm not trying to be a doctor. I'm trying to be a PA, doing what I've been trained to do and what these hospitals and clinics and organizations, what they're expecting me to do, what my supervising physician is expecting me to do within that practice. So not only am I not trying to be a doctor, but I do have a license. In fact, the license that I have to practice medicine as a physician assistant was granted by your organization, the Texas Medical Board. They reviewed my training, my education, my application, and they granted me a license. So, yeah, I don't know what you're talking about. Then he goes on to say they don't have any training, much less experience and the oversight to do these kinds of procedures. Well, before I go into this, they don't have any training. So talking about PAs, 6 to 7 years of schooling, most of the same undergrad classes as MD students: biology, cell biology, microbiology, genetics, virology, anatomy and physiology, chemistry, biochemistry, psychology. I'm sure there's a few more science classes that I missed in there. And then when we get into PA school, we cover pathophysiology, more anatomy and physiology with dissecting cadavers, pharmacology, physical exam skills, learning diagnosis, learning disease processes. In fact, we've had several shared classes with med students. We pass a national licensing exam and we have 2,000 hours or more of clinical rotations. So I wouldn't say that that is no training. Now, how about when he says we don't have the experience? Well, again, per our scope of practice in our current laws, it says that we are authorized to do things within our education, training, and experience. So if you come out of school and you have been trained and been shown how to do something, you have experience doing it, that now becomes your scope of practice. Obviously, there are hard lines in the sand, like doing independent surgery. I'm not talking about that. I'm just talking in day-to-day practice. And then what about when he says no oversight? They're not going to have oversight doing these procedures. Well, again, speaking from the PA standpoint, we're still bound by those hospital and clinic procedures and policies that I talked about earlier. We are still subject to discipline actions by the Texas Medical Board. We have to answer to complaints. We can be sued. We carry our own malpractice insurance. We can lose our license if we're not practicing how we're supposed to. Plus, we are also medical professionals. We take an oath, just like doctors do, to do no harm. We are not cowboys out there, yahoos that just want to prove that we can do stuff. We are caring, dedicated medical professionals who work within our training and our scope. Now, are there outliers? People who are out there, PAs who are dangerous and doing bad things? Yes, of course. Just like in any profession, there are people who don't follow the rules and do what they're supposed to. Just like all the MDs that you hear about, that they make these crazy TV shows about, who have maimed and killed people. Okay, it's going to happen. But the majority of PAs are very cognizant of working within their scope of practice. So again, you could call them hyperbole, you could say it's disingenuous, or you can say that what they're saying are outright lies, because they are. Now I want to talk about the third point, the lies about licensure compacts. So Dr. Callis goes on to say, and I think the newest trend that we're very concerned about is we're seeing legislation that interstate compacts, where a state outside the state of Texas grants someone from outside the state their law originating from their original state to come across our borders and practice independently like they do in their own state. So we have full scope in our home state. It's not really well said, but what he's trying to get across is that he's saying with the licensure compacts, if you're licensed in a state that allows independent practice and you become part of the compact and get a reciprocal license in Texas, then you have all of the authority to practice independently in Texas as well. Well, no, lies. That's false. That is blatantly false. The licensure compact, all it does is to speed up the bureaucracy part of getting a license. So you don't have to fill out multiple applications. You don't have to get multiple sets of fingerprints. You don't have to send your education to multiple states. It's a faster process and cuts down on red tape. That's what licensure compacts do. The licensure compacts specifically state, and again, not hard to find. You just go to the licensure compacts. They specifically state that the person who is licensed in a state is subject to the laws governing their practice in that particular state. Whenever I'm practicing in a particular state, I'm following those state rules. Very straightforward, very simple. It's not confusing, and no one is saying, other than them, that the licensure compact is going to just make it a free-for-all and abolish different state laws. Like I said, these are not hard things to fact check, but it just leads me to think that the AMA does not care about facts. They just want to run this campaign to scare people and lawmakers and to really muddy the waters about what is happening in medicine. Now let's talk about the fourth point, what I consider to be bullying. Dr. Callis says, Last session, we roughly fought 140 bills related to scope of practice where we worked hard. I'm proud to say that out of those 140 scope of practice bills, not one expanded scope of practice, not one. I will say the first, and I'm very proud of this, is that the largest bill was an independent practice bill that the chairman of Health Service Committee was a nurse. She couldn't even get that bill out of her own committee. We didn't even let it get heard. We also did some other things. We had one bill that slipped through our cracks a little bit, but what we used on the floor techniques with our scope of practice partnership lobby. We were able to listen and learn and make sure we utilized every niche and cranny of oversight with our lobbyists at AMA, and we were able to kill it on the floor. And how we did that, we used strategic lobby contacts. We also followed up. We followed up. We followed up. We made sure our physicians called their friends and we got it killed. So those are just some of the things that we did. I don't know if you just listen to this guy, he sounds like a zealot. Everything is absolute, and there are no other positions that are valid, just their position. And they are proud of shutting everything down. He brags about not even letting a bill get out of committee to be debated and discussed on the floor. If that's not bullying, I don't know what it is. They're using their power, the power of the MD title. I talked to some people who have gone and lobbied for PAs and for the PA legislation. And they said, they can talk and throw figures and studies to lawmakers. But as soon as somebody with an MD behind their name speaks up, they said you can tell the lawmakers kind of lean in and listen extra hard. So it's a traditional power situation where someone with more power is using that power to suppress thoughts and ideas and then just bullying their way and getting what they want without any discussion or any opposition. I mean, 140 bills were killed. Are you seriously telling me that out of 140 bills, not one of them had merit? Not one of them did anything to help the general public to increase their access to medicine and medical care? I don't know. You tell me. Does that sound reasonable? It doesn't to me. And additionally, he talks about excerpts about the underserved or AMA interviewer. He says, well, I'm curious, when you talk to the policymakers in Texas about the risk of scope of practice expansion, what do you hear from them? And Dr. Callis says, well, that's really a mixed bag. On one end, we have those who know what it means to be professionally licensed individuals who have gone through the educational channels to get licensed and feel that same should be true in medicine, like the attorneys, like the engineers. Then we have those that feel some level of care is better than no care for rural and underserved areas. However, and hear me out on this, what I found most interesting is those elected officials that live in underserved, lower socioeconomic areas. They feel that expanding scope of practice decreases the level of care that these Texans deserve, meaning that they will be treated at much less standard than the regular Texans because they live in a lower socioeconomic or rural area. Okay, I have to try not to get really pissed off when I read these things. So first of all, he says that the politicians feel that their constituents are going to get a lower standard of care. I wonder why they feel that way, Dr. Callis. Is it because, as you said, you are following up, constantly calling, constantly whispering in their ear about how dangerous anybody other than a physician is and how substandard that care is that their constituents are going to receive? I don't know, that could be a little part of it. And also, just it's so offensive talking about how substandard our care is. I've worked for many years and I look at my charts, I look at charts of other physicians in family practice, and we're essentially practicing the same. I'm sure there's differences. In fact, there are differences, good and bad, both ways, but it is not substandard. And so let's talk about hard evidence. If it's not just that they're bullying and influencing, they must have a lot of hard evidence, right, to back up all of this campaign. Surely they wouldn't launch out on these expensive campaigns if they didn't have that evidence showing how unsafe we are and how much better patients are when they receive care from a physician. So, in point number 5, I'm calling flimsy evidence. The grammar doesn't make sense, but Dr. Callis says one thing that has also been really helpful in its efforts to the data that AMA continues to provide for us on why scope expansion is not the answer to underserved areas. From the heat maps to the VA emergency department study, these are all hard data points that show it's not the patient's best interest to allow any scope of expansion, and that's what we will be using. So let's look at this hard data. First of all, when he's talking about the AMA heat maps, he's talking about the AMA Health Workforce Mapper, which is a free interactive tool that anyone can use. Just go on the AMA website and you can see how it works. And it says, view the new Patient Health Explorer, which provides a rich supply of patient health data, including morbidity and mortality rates, information on patient health behaviors and social environment, healthcare access, and quality data. So that would lead you to think that you can see reports about what kind of care the PAs are giving in that area, or the physicians, or the NPs. No, I couldn't find it. You can look and see if you can find it. What I did find is that you can see what areas have PAs, NPs, physicians, and you can see the disbursement and who's working in rural areas and who's not. It also can identify areas of potential need for certain medical specialties. You can view locations of hospitals, rural health clinics, and other healthcare facilities. View geographic features such as highways, mountains, and rivers that may be affecting the access to care. The incident rates of cancer in certain areas, or how many people smoke in a certain area, or the incidence of diabetes, different things like that, which are all great and important things to look at, but there is not one thing that can tell you the quality of care that anyone is receiving from any of the providers, be it physician, PA, NP, nothing. So it's a helpful tool to understand the landscape of medicine, but it has absolutely no data in helping determine and show whether PAs give effective and safe healthcare. Prove me wrong. If you can show me wrong, I'll stand corrected. But I don't see anything on there like that. So I don't consider that hard data. I mean, it's data, but it's not data about what they're talking about. Now, next, let's talk about the study that he cites, the VA emergency medicine study. Now, it's important to know that this is a working paper written in 2022, meaning that it has not been peer-reviewed to prove that it's a legitimate study, and it has not been published anywhere to my knowledge. Beyond that, the study is looking at the care given by physicians versus nurse practitioners in ERs in the VA system for a certain period of time after nurse practitioners were granted independent practice with the VA. Sure, it could be a useful study. I'd like to see the data once it becomes peer reviewed and look at the methodology of how they did it and make sure it was a good study. But all of that is irrelevant because it's only looking at NPs. It's not talking about PAs at all. No PAs were in the study. So there's no evidence there against our profession, at least. And what is there against the NPs, like I said, is not peer-reviewed yet. And then the only other study that I can find that they reference on their website anywhere that I could find was the Hattiesburg Clinic study. It was looking at PAs and NPs together as a group and did not sort out by profession, so you can't really compare because PAs and NPs have different training and you can't lump us all together even though we do similar things. So let's recap. They have a health workforce mapper tool that has no data that can be used to back up their arguments. They have one study that has not been peer reviewed and not published, and they have one study that has been that lumps two professions together, looking at that against physicians. That is their hard evidence that they are basing this entire campaign on, that they are influencing lawmakers and squashing bills and putting all of their time and effort into. Now, I want you to contrast that to AAPA's website, where I can show you a page that has 30 different studies listed. They have the links. You can go read the study. They're peer-reviewed and published studies that show that care by physician assistants is safe, and has good quality care. Now, you may argue with those studies and how they're done, but there's 30 studies listed there. Where is that page of hard evidence on the AMA website? I can't find it. Again, if you can find it, let me know. I'd love to see it. So, how can they go out there and say all of this stuff about how unsafe we are if they can't even show us like solid data? Instead, what they're doing is they are relying on the power that comes with their title of MD, the power that comes with the history and how well known the AMA is to lay people. They think the AMA is everything. And they're using that power to bully lawmakers and to run a smear campaign. I don't know what else you'd call it. That's how I see it. And again, if they were out there just having legitimate debates and bringing up this question, I would be perfectly fine with it. But if you can't back up your argument with legitimate data and you can't make a case for your thoughts without putting down other people and telling lies about them, then I just have to question you. Somewhere I read on the AMA website, they said that they spent $3.5 million this year on the scope creep campaign, this year or last year, I'm not sure which year, but $3.5 million to basically spread lies and to bully lawmakers. I don't know about you, but I think $3.5 million can be used in some better way in medicine. Like, oh, I don't know, fighting the power that insurance companies now have over the healthcare systems. Maybe they could use that money and their power to stand up to the businesses that are running medicine now and advocate for safe patient counts for providers and for nurses and for everyone who handles patients in the healthcare system. Maybe they could put their significant brain power and intellect into helping craft a new way to move forward with the healthcare system, a new way to keep physicians and all of their incredible knowledge and training, but still incorporating and bringing in PAs and NPs and other healthcare professionals and let us do what we've been trained to do. But the bottom line, and again, I'm speaking only from the PA perspective, is that we are not looking to increase our scope of practice. We want to get rid of some of the burdensome regulations that affect our ability to get licenses and to get hired. We advocate for a whole team to care for patients, and we want our physician colleagues to be there. We want to work with them. We respect them. But we're feeling very disrespected and very dumped on from the AMA. You know, the way we look at it, physicians have benefited from our work for years. A physician created the PA profession, and physicians have helped nurture us through the years. And there are a lot of great physicians out there, but there are a lot of physicians who have benefited financially and also in their quality of their life from having PAs work with them. We often do grunt work. We often take the difficult or annoying cases that physicians don't want to deal with. They often get dumped onto PAs. Sometimes physicians work lighter schedules or leave earlier because the PAs are there and NPs to carry on the work. We cover for them when they go on vacation. Sometimes we're in there cleaning up their inbox in addition to our own inbox and the patients we have to see. We free up time for them so they can go log more RVUs and make more money while we're doing the work that can't qualify for RVUs and we can't get bonuses on. In many cases, we've helped increase how satisfied the patients are in their practice, and we have helped cut down on wait times. Physicians are the ones who have been in charge of medicine and still have a lot of power in medicine. PAs don't. We don't have the power. But now, because we're asking just to be treated fairly and to get rid of some regulations that are detrimental to our profession that won't affect how we actually practice, physicians are feeling threatened, and the AMA is striking back at us, and they're lashing out at us. And you know what that feels like? It feels like we're in an abusive relationship. And all I have to say is, no wonder we want out of it.